Now once again, now we are talking about the nuclei of origin or nuclei of the various cranial nerve. We have to write down the name of the nuclei and their distribution and the location of nuclei. Let's see how we are going to write down about the nuclei. First, somatic efferent, nuclei of somatic efferent because they are the motor nuclei. So what is our statement? Motor fiber arises from the motor nucleus of oculomotor nerve situated in midbrain at the level of superior colliculi. What you have to do, you have to change the nerve name here and the place of the brain from where the motor fiber arises. For example, for the trochlear nerve, statement remains the same. Here will comes the trochlear nerve situated at midbrain at the level of inferior colliculus. Okay. Same thing happened with the special visceral efferent because they are again motor supply for the muscle developed from the pharyngeal arches. The line remains the same. Motor nucleus of mandibular nerve or trigeminal nerve situated in upper part of pons. So for the statement for the general visceral efferent which is carry the parasympathetic fiber. So our statement is preganglionic parasympathetic fiber arises from lacrimetal nucleus and superior salivary nuclei in lower part of the pons or at the level of facial colliculi. For the third nerve, we can have preganglionic parasympathetic fiber arises from Edinger-Westphal nucleus situated in midbrain at the level of superior colliculi. For the general visceral efferent, because now they are carrying fiber, so general visceral efferent carry the general sensation of the viscera to the nucleus of tractus solitarius. So nucleus for this is tractus solitarius. Say and now for the special visceral efferent, which is actually goes through the gustatory nucleus, which is the cranial most part of the tractus solitarius. But we write down carry the special sensation of the taste from dash part, that means anterior tooth of the tongue, except circumflex papillae for the seventh cranial nerve, and terminate in the nucleus of tractus solitarius. For the ninth nerve, we write down this statement at this place and remaining statement remain the same. For example, for the vagus nerve, our statement is carry the special sensation of taste from posterior most part of the tongue and epiglottis and terminate in the nucleus of tractus solitarius. So there are common steps. Here we have to replace the content which is present in the different cranial nerve. Same with here, same with here, same with here. For general somatic afferent, carrying the general sensation from the head neck phase for the trigeminal nerve, terminate in trigeminal nerve. For the 7th, 9th and 10th nerve, the carry the general sensation from the auricle, terminate in the spinal part of the trigeminal nerve or spinal. Now for the special somatic afferent, carry the sensory information of the maintenance of equilibrium, terminate in the vestibular nuclei. For hearing mechanism, our statement is carry sensory information of hearing, terminate in the cochlear nucleus. So we can see that there are the common statements are there, but we have to replace the nuclei name. So by just changing the nuclei, we can write down the nuclei and their component in the form of statement. Okay. Now let's see where are the nuclei and their position, that you have to learn this table. For example, in the midbrain, this at the level of superior colliculi, the motor nucleus of oculomotor is present and Edinger-Westphal nucleus for the general visceral efferent is present. Mesencephalic nucleus of this trigeminal is also present, which carry actual proprioceptor fiber from the temporomandibular joint. In the midbrain, at the level of inferior colliculus, trochlear nuclei is present. only single nuclei. This nerve carry only single nuclei. Upper part of pons, the fifth cranial nerve come out. So this the motor nucleus or trigeminal nerve is present here, and the chief sensory nucleus is present here. At the level of facial colliculus, two nuclei present. One for the abducent, because abducent carries a single nerve fiber, and the motor nucleus of for the seventh nerve. We write down about the motor nucleus of facial nerve. As along with that, there is a general visceral component, that is lacrimetry nucleus and superior salivary nucleus. Okay, and then third component, which is the this thing. The nucleus tractus solitary actually present in the medulla, but also supplied to the seventh nerve. Okay. And then spinal nucleus of trigeminal nerve, the fiber ultimately. So these four component in the seventh nerve. Okay. For the eighth nerve, I have not mentioned because there are nuclei present in the medulla and the pons. So I have not mentioned here the. Okay, sorry, I have mentioned here vestibular cochlear nuclei. After 8, then the ninth. Now you can see all the because all the nuclei mostly the present in the at the level of medulla. So 9th, 10th, 11th, and 12th cranial nerve, they emerges from the medulla oblongata. The last four cranial nerve from medulla, two cranial nerve from the this thing, two cranial nerve from the midbrain, 2, 2, and 4. Okay. So that is the distribution of the various cranial nerve. After the this thing, then we have to write down the intraneural course. Means the nerve fiber after rising from the nuclei, the course of the nerve fiber in the substance of the brainstem. So common line we are going to write down. So our statement for we write down intraneural heading as an intraneural course, and our statement is after arising from its nucleus or nuclei. If there are multiple nucleus, then we will write down the nuclei. Otherwise, single nucleus, a single component, we write nucleus. So after arising from its nucleus or nuclei, the fiber of dash the, for example, for the oculomotor nucleus, after arising from its nucleus, fiber of oculomotor nerve passes forward. Then we have to remember which cranial nerve move forward, which cranial nerve go backward, which cranial nerve forward and laterally. So if you remember the attachment on the brainstem, there are three cranial nerve which are arises ventrally, one cranial nerve arises dorsally, and then remaining cranial nerve arise anterolaterally. So what are the three cranial nerve which arise ventrally? They are the third nerve, sixth nerve, and 12. You can remember 3 multiplied by 2, 12, 6 multiplied by 2, 12. So just doubling the number from starting from the 3. So these are the cranial nerve which arises from the ventral aspect of the brainstem. So when they arise from ventral aspect, the course of the nerve mostly forward. Okay. And they emerge on the ventral surface. The only cranial nerve which is arises from dorsally, the course remain the backward, and they arise from the dorsal surface. The remaining all cranial nerve mostly the course remain in the brainstem forward and laterally and emerges on the ventral surface but in the anterolateral direction. I put the star mark for this 4 and 7th cranial because we are going in detail for these two cranial because of the extra things in regarding these two cranial nerve in the intraneural course. So again, I am just repeating our statement for the intraneural course is after arising from its nucleus or nuclei, fiber of dash nerve passes. If it is forward, then forward. If it is going backward, then right and backward, or other for rest of the forward and laterally. We choose one word from these three. Through the substance of which part of the brain? First two cranial nerve goes through the midbrain, next two goes through the pons, and the last four from the middle oblongata and emerges whatever the surface. Mostly the except for the fourth cranial nerve, mostly emerges on the ventral surface of the brainstem. So this is common statement. Just remembering which side the nerve goes, we can write down the intraneural course. Okay. Now let's talk about the fourth cranial nerve and seventh cranial nerve. What are the peculiarity of these two nerve in intraneural course? Trochlear nerve trochlear nerve, the statement will be after arising from its nucleus, fiber of the trochlear nerve passes backward. Okay, the same thing through the substance of midbrain, and so this much remain the same, but here changes. It reaches into the superior medullary velum. Here the fiber are decussate. This is the key word here. After decussation of nerve fiber of left and right side, it emerges on the dorsal surface of the brainstem. For the facial nerve, because there is a phenomenon known as neurobiotexis, the course of the facial nerve is different from the other nerve. First, after rising from its nuclei, fiber of the facial nerve moves backward and medially, then ascend at the upper pole of the abducent nucleus. From there, they passes forward and laterally through the substance of midbrain. It emerges the ventral surface of the brainstem. So only thing, it first initially go like this way, for, backward and midly, and then crosses the abducent nucleus and then go forward. So just like question mark there, this is the course I will show you in the diagram. Okay. So this is the intraneural course of the various nerve. So mostly the fiber goes forward. Only cases of this thing, trochlear nerve and facial nerve, they go backward. Facial nerve again convert forward and laterally. So this is a various diagram, so you can understand the intraneural course. For example, this thing, the oculomotor now, you have to draw a level. This is the diagram you have to draw. That is the transverse section of midbrain at the level of superior colliculus. As I mentioned many times, you have to practice the 7th section of the brainstem. So one of the section in which the third nerve, that is the oculomotor nerve, is present, that is at the level of superior colliculi. So what is your statement? What we have learned here? So nerve fiber arises from the motor nucleus of oculomotor. Along with that, here is the Edinger-Westphal nucleus. Just this level of the Edinger-Westphal nucleus is there, which is not mentioned there. You put dot here, and that is Edinger-Westphal nucleus. After rising from Edinger, this fiber goes forward and emerges just medial to the this crus cerebri. Now the course of the trochlear nerve, as I said, after rising from the fiber from the motor nucleus of the trochlear nerve, the fiber go backward, both side, and this is the place where the superior medullary velum is there. They cross decussate here. Left goes to the right side, right goes to the left side. After decussation, they go outside. For example, trigeminal nerve, after arising the fiber, they goes forward and laterally. The motor nucleus along with the sensory fiber goes forward and laterally. Let's say for the facial nerve, you can see here the facial nerve. The facial nerve, after rising, the fiber goes first medially and backward and reaches cranial to the abducent nucleus and then go forward. This is because of the motor nucleus try to reach their sensory nerve supply, that is the trigeminal nerve, and this phenomena moving of the cranial nerve nucleus toward their sensory supply is known as neurobiotexis. So there are four components of the facial nerve. You can make here the superior salivary nucleus. You join the fiber here, the motor nucleus of fiber, and then the spinal nucleus, spinal nucleus of trigeminal nerve, which is connected here. So they all component the content. So you have to draw this diagram. In this, if you using this diagram, you can use for the 6th, 7th, and 8th cranial nerve. These are the vestibular nucleus. These are the these are the vestibular nuclei, and there two are the cochlear, dorsal and ventral cochlear nuclei. And these are the fiber from the abducent nuclei of motor fiber after rising move forward and emerges at the ventral surface of the pons, lower part of the pons. So that is the intraneural course of the this thing, and these are the nuclei of the cranial nerve. For the 9th, 10th, 11th, and 12th cranial nerve, we can use this diagram, which can be used for the any cranial nerve if it comes. For the hypoglossal nerve fiber, after motor from the motor nucleus or hypoglossal nerve, nerve fiber passes forwardly, slightly laterally, emerges between the pyramid and olivary nucleus. For the rest 9, 10 and 11 nucleus, here they are showing the vagus nerve. The same path you can use for the 11th, because the 11th cranial nerve only arises from the nucleus ambiguous, and you just draw and then connect this fiber here. That is for the ninth nerve, because 10th cranial have all the 5 components. So here the nucleus tractus solitarius is there for the sorry, nucleus ambiguous for the 11th. For the 9 cranial nerve, all the 5 components same thing, 1 2 3 4 for the general visceral efferent and special visceral efferent, that is for the nucleus tractus solitarius, and then you connect the spinal nucleus or trigeminal nerve for the general somatic efferent. So these are the all 5 component, 1 2 3 4 and 5. So you can use this nuclei and you connect. You show here 11th cranial nerve, 10th cranial nerve or 9th cranial nerve. Whatever the cranial nerve, you have to draw this diagram. Okay. So one